Hello everyone. Dr. Barbara, we're going to be starting with you. So
Okay.
it's so nice to meet you, really, but we would love you to introduce yourself to our audience and our community.
Okay, no worries. So yeah, like you said, my name is Dr. Barbara Osamwonyi, and I am a GP with a special interest in women's health. I'm based everywhere at the moment, but mostly in East London and Essex. So I'm just looking in, and yeah, what else can I say? So I'm very passionate about all things women's health, and I think that was like um, yeah, engineered by my own personal struggles of having fibroids and then, multiple surgeries for that, and then finding out I had endometriosis, which took a long time to get a diagnosis for, and then battling fertility issues as well.
Oh,
So this made me think about all the people who are just like me who don't even have a medical background, who are struggling to find answers. So I think that's what, led me to kind of focus more on women's health and health education in general as well. Yeah, I think that's it for now.
all right, thank you so much. I mean, I see a lot of what you do online, and it's a really good work. Yeah, thank you. So, my next question is just going to be, when did you first realize that something wasn't right, especially with your period and reproductive health?
So when I was in med school, I think I
Mm.
kind of knew when I was in secondary school, my periods were too heavy, but I didn't have the
Oh.
knowledge. Or my mom's periods are heavy, it's family thing. But when I was in med school and I was learning more about it, I realized when I was learning about fibroids, I was ticking every box. It was like heavy periods, bleeding longer than 7 days, flooding, leaking, passing large clots. I had every symptom. So I kind of presented myself to my GP. Unfortunately, then I didn't actually get a scan. I had a
Mm.
blood test and I was treated for iron deficiency anemia. And for anyone who's like ever, been in school, you just get carried away. And so I was just carried away with med school. I traveled, and it wasn't until I was doing a night shift and I collapsed because the anemia was so bad. And I had to go into hospital and then had a scan and all of that. And they said, oh, okay, you've got this huge fibroid. And then I think we went into lockdown after that. But that's kind of what led to all the other diagnoses. But it's always kind of been there, I would say, from uni.
Oh, well, so sorry. So, my next question would be, how has it been like, how was it like managing both your professional career and all of these diagnoses?
Yeah, it was very tricky because med school is full on. So, you've got to really be on the ball. And it's not easy to do that when you're always tired. I was napping
Mm.
in between. That's how bad it was. Like I couldn't just keep going. I'd nap during the day when I could, and then, study at
Mm.
night when I had little energy. Um, and I feel like I kind of just pushed myself to get through med school. I was literally just on autopilot, just going through the motions, but I was really struggling when I look back now. And then obviously, I decided to go into GP training, which actually wasn't my first this choice. That's not the first thing I wanted to do. I originally actually wanted to do obs and gynae, but I think I felt that I would struggle to do night shifts, to do the weekend on call. So I kind of GP is something else I'm passionate about as well. Let me go into that, and maybe I'll be able to cope a little bit better with the way the training is and everything else, and the duration of the training as well. And it was challenging, so I did have to take quite a few breaks during my training because of surgery for the fibroids 3 times. Um, so that did delay in, finishing. I was able to do all my exams on time. Luckily, I don't know how, but finishing completing it took a little bit longer because of the time out I had had. So yeah, I think it was hard to strike a balance between, being unwell and also looking after patients as well. It's quite a weird place to be in. You're
Mm.
struggling, like, I can remember seeing people in clinic and I've flooded, I've leaked. I know I can't sit down, so I'm pretending, to the patient that, you know. stand and, examine you and just talk, like this, because I know if I sit down, I've leaked everywhere. There's no point. So there were times when it was really hard, like thinking, is this what my life is going to be like? But I hope that answers that question.
Yeah, actually it does, and it's actually a sad one. I know I'm not in the medical field, but I can just imagine how it could have been treating somebody and you're also in that situation.
Yeah.
But I'm really glad that you're able to come out of it, really. And now you're able to share your story for so many other women to learn from it. So that is actually good. So I'm just going to ask you one more question before I move on to Dr. Omar. So my next question would be, during your process, did you ever feel dismissed by the healthcare system?
Yeah, unfortunately, many times. Like I said, I first thought something was wrong when I was in med
Mm,
school. So that was quite a time ago now. And I felt like I was made to believe, it's just a heavy period. I knew deep down that this is like I was bleeding on weeks at a time. But I knew something wasn't, and I just felt like even though at the time I was with that little that I had, I still wasn't really always listened to, and that's what I always emphasize the importance of seeking a second opinion, because if I had not, I probably wouldn't have ended up getting my endometriosis diagnosis as well. All I felt like I had to push for, and it really shouldn't be that hard to be listened to, because I always say to my patients that you are the specialist when it comes to your body. No one knows your body like you. If you feel
yeah,
something's right, no one can, feel what you're feeling. So
yeah,
don't miss you. But that has come from me experiencing a lot of dismissal and kind of feeling like I was exaggerating my symptoms as well. I felt that a lot of times, and that makes you silent. And there's
yeah,
no benefit in, suffering in silence.
yeah.
Yeah.
I totally agree. Thank you so much, Dr. Barbara. Thank you. So, Dr. Omar, so I'm just going to ask this. So, what are some of the current non-surgical treatments for fibroid? I'm very sure there are some non-surgical treatments that are available, if I'm correct. Yeah. So, what are some of the current non-surgical treatments and how effective are they?
The non-surgical treatment, we have to choose the patient. It's very important to choose the patient, which one, and the age of the patient is very important, because it takes time, especially with the drugs, with the tablets. But basically, the tablets is make the size of the fibroid. This is used for moderate to severe cases, which is suffering from the fibroid problem, and it is reduced the size of the fibroid nearly by half within 6 months. And if we continue for a year, it is going to be smaller and the symptom will be better, which the symptom is pain, bleeding, even emotional and psychological and economic side of the impact of the fibroid on a patient. So there are tablets. There was one which is called Ryco. Ryco also, it is inhibit all the hormone release from the brain down. But unfortunately, Ryco, although I used before, the size of the fibroid reduced by half after a year, but have impact on the bone brittleness, which is called osteoporosis. So I am not very much in favor of that. But also it is caused hot flushes, sweating, like menopausal symptoms. So few patients, they didn't like it from the beginning, and it takes 2 to 3 months to stop the bleeding. There is a new drug, a similar action, but have a very much benefit. It's called Linzagolex, which is called Yazalti. This one is you can use it for 6 months without any estrogen support. It means the estrogen is for the brittleness of the bone to avoid that. Reduce the size of the fibroid by half within 6 months. So it just came, it is a lot of research around, but just came to the market. It's at 100 to 200 milligram. But if you're using it for a young people, it's better 200 milligram from the beginning because you need, fertility and all these things to be improved quickly. So 200 milligram using it up to 6 months and then reduce the size of the fibroid by half. And can be after that used for a year. Especially if you don't want to do a surgery or give the patient a chance to have a fertility. If they wanted to have children, then they can have their children, then come back and reassess the size of the fibroid and situation with the patient in. This is one side of the medical treatment. The second one, it is called uterine artery embolization. It is invasive. It is radiology usually do. They put a cannula inside the artery in the groin region, and they put a plug which block the blood supply to the fibroid. When it blocks the blood supply to the fibroid, within a year, the size of the fibroid will become half. Can be used for many fibroid, patient who's really suffering from many fibroid, but it is sometimes tricky because if too many fibroid there, it can interfere with the blood supply of the uterus. So far, in whole my career, I have seen one patient which was done and end up with emergency hysterectomy because the blood supply to the womb, when it is completely stopped, it lay like rotten. It become like a rotten meat in the outside when you put it outside. So only one patient. The other drawback of that can have a 5% chance interfere with the blood supply of the ovary and cause menopause. So a lot of women, when you discuss it, is not in favor, especially if the fertility issue is important. So that's the second one. And there is also thermal radio frequency, which is not available in UK, is available in USA, which is they pass it over the abdomen of the patient and they say it reduces the size of the fibroid. There is also like preparation of patient for the surgery. There's injection, but the injection also has monthly injection. It has also drawback of menopausal symptom, hot flush and sweating. It's not a treatment per se, but it is used pre-surgery to reduce the size of the fibroid and reduce the amount of bleeding the patient will have during the surgery. So these are the one which is more popular and is available in the market and can be used. Especially if the patient is nearly 40, over 40, you can use all of these and they have a very good chance not to go through the major surgery. And also depend where is the fibroid, how many fibroid, and as I said, the fertility side and any coexistence of any other problem with. Because sometimes, yes, ultrasound can show us the fibroid, but cannot show us other problem, especially if it is not very high stage. So you have to be aware what using it for and which patient using it. Every single individual is separately treated. You have to know the age, fertility, the symptom which they are suffering from, and the number of the fibroid, the situation of the fibroid, and what they want. So you have to also not only one session or two, you have to give them a chance, you have to send them information and let them to think about it with their partner, with their family and what they want to do, and then they come back. And you have to be very careful about what side effect each procedure, each tablet, each injection have, and don't give them a false impression that everything will be all right. You have to be very, very plain with them. This is what this one do, this is one, and then follow the patient carefully. And you have, with the tablet, you have to have a liver function test normal before you starting with, and then repeat it in a 6 month, and then repeat it in a year, because sometimes can be absorbed through the liver system and can affect the liver function.
All right. Thank you very much for that detailed explanation, Dr. Omar. So you actually answered some of our subsequent questions. But before we go on, for our audience, those of us watching, please, if you have any question, please, you can just put it in the chat and then we'll come back to answer it. So Dr. Omar, I have one more question for you before I move on to Dr. Barbara. So we hear a lot of women talk about how fibroids can shrink naturally. So I just want to get your opinion on that. Do you think fibroid can shrink naturally? Is it possible through menopause? Is it diet? Is it through lifestyle? Is this something that is possible? It's just a hearsay.
The lifestyle is important to be, and diet is very minimally affected. That's what's the lifestyle about, when the excessive amount of red meat and also soya and soya milk, soya yogurt, because it has a lot of estrogen. But during reproductive life, when we talk about the teenage, when start period, till about near to 50, we don't expect anything can shrink the fibroid. Sometime can happen when the blood supply of the fibroid becomes so big, and the blood supply, it become not enough to the fibroid, so they call it red degeneration. It may end up with very severe pain in that patient, but it may end up with become slightly smaller because the blood supply was not enough for it. But can shrink after menopause, and after menopause it takes like 3 to 5 years to become half, and if it is very small, to be none. But bear in mind, now menopause symptom, we know what is the menopause. We know what is the menopause symptom look like. It's not like a long time ago, 20, 50 years ago, when the woman become menopause, said, oh, thank God, the period stopped and I am okay. Hot flush and sweating and sadness and anxiety and sleeplessness, all is become something normal to them. So the fibroid was shrinking. But nowadays, you can't live with a menopausal symptom. Menopausal symptom is very, very difficult. And there is treatment also. So if you start in menopause and you start in the HRT, which is hormone replacement therapy, then it grows a fibroid again. And some patients, they don't know that. When we tell them, oh, if they come with the pain and bleeding and say, oh, the fibroid is increasing in size, they say, why? I am menopausal. No, if you have HRT, still it is causing increasing in size of them. So there is no natural per se to reduce the number of the fibroid. Can red degeneration reduce the size of the fibroid, but not maximally? It is maybe 10%, but that is luckily if it happened, which has happened during the pregnancy sometime, but not always. Not always. But of course, lifestyle, weight, and diet is not going to shrink it. It's going to be maybe stay as it is.
Okay. Thank you very much, Dr. Omar. Thank you so much. So, Dr. Barbara, I want to ask something related to the cultural and systematic consideration. So there is this saying about Black women being the one more prone to fibroid, if I'm correct. So now my question to you is going to be this. Why do Black women tend to suffer more with fibroid, especially in relation to number and all of that? Is there a peculiar reason, or it's just...
I don't know, Dr. Omar. I think it's quite complex. I personally, with all the research, haven't found one single answer that says this. Yes, this is the reason. They always put a series of things. Okay, so they say our diet. Maybe it's linked to the diet that we have. Eating more processed red meat, all the things that we are told to stop when you find out you have fibroids, and then also we're more likely to carry more weight. Risk of obesity and any kind of increased weight around the tummy can lead to sometimes excess estrogen, and maybe that's what's fueling fibroids, genetics, all of these things. It doesn't point to one thing, because you can see this in other populations as well. You can see that they're eating processed as well. They are overweight as well. Just look at America. So it's not. I don't think it's clear cut. I don't think if someone was to ask me, I wouldn't confidently be able to tell them, this is why Black women get it more. This is why more research needs to be done. I don't think the way the government sees fibroids. I think endometriosis is starting to have more of, a voice, and people are taking it more seriously. And when that happens, that leads to more research and more funding. And unfortunately, I don't think fibroids has that same, correct me if I'm wrong, others disagree, but I don't think it has that same kind of voice yet. And I think that's what's needed. A little bit more research into specifically why Black women, we have it at younger ages, and we have more severe symptoms as well. I could have the same size fibroid as maybe, my white counterpart, but I may experience far more symptoms than them. And the why isn't really clear. And I think a lot of people want to know. It is quite frustrating hearing this statistic, with it.
Thank you so much, Dr. Barbara. So, Dr. Omar, tonight we are also talking about fertility in relation to fibroids. So, is there a particular point where it is difficult for you to give birth when you are fibroid?
Just to add into the why fibroid is more in the Black women, because if you look on the collagen tissue of the Black woman is very, very strong. And muscle fiber and density of the muscle is very, very strong and very dense. So I think because it is a proliferation of the fibers and fiber cell, and when it's proliferate, they proliferate badly and make these fibroid. But the only thing which is the problem is a diagnosis, is a delay in diagnosis. The delay in diagnosis make the fibroid much bigger, make the fibroid multiple. So not listening to the women in the early years, especially after menarche by age of late teen or mid-20s. If you listen to them, you can find there and we can advise the women. Yes, of course, yeah, overweight is very important, and yam also have hormones, so it's affecting. And Black community, they eat yam quite a lot. I'm aware of that. But if you diagnose it from the early age, it will be much, much better. Yes, infertility, yeah, it is affecting the infertility. First, if you have a fibroid, you're bleeding every day. You have so much heavy bleeding. You have so much pain. This is practically is affecting of the fertility, how you can have enough intercourse to become pregnant. In addition of a number of the fibroid, where they are, where they located, how they are related to the tube. Sometimes fallopian tube is being so distorted in a different direction from the ovary. So even if you ovulate improperly, the eggs will not reach the tube to go, or the sperm not reaching the egg to fertilize. And also there is a type of fibroid which is sitting inside the womb, which called submucous fibroid. Submucous fibroid, like you have a coil, you have a contraception. So if it's sitting inside the womb, even if you become pregnant, it doesn't implant. Even if you implant, it causes very early miscarriage. So all these is impact on the pregnancy and fertility, and sometimes it is so many, and later in life you're having a surgery, and the surgery cause a lot of scarring, and scarring cause blockage of the tube and distorting of the uterine cavity, distorting of the uterine muscle, and that impact on fertility also. And coincidence, to be honest, I just feel that is very unlucky when there is coincidence of endometriosis with a fibroid. So endometriosis by itself is causing infertility most of the time, and then you have a fibroid which is mixing up. So it's only pain and ultrasound pain and bleeding and ultrasound should not be enough for diagnosing the pain of the fibroid. You should know. And sometimes MRI scan we do, but even in the early stage 1 and 2 of endometriosis, has to have a laparoscopy to make a diagnosis. So these all impact on the fertility. It's basically impact on the fertility. So that is altogether fertility will be difficult. But if the woman knows they have fibroid, I know it is not easy to find a partner and try for pregnancy. Early, between 20 and 35, is better to have children than waiting later, because the fibroid become bigger and occupy all the uterus, and you may have also endometriosis will progress to a higher stage. So altogether will interfere with the fertility quite a lot.
Thank you so much, Dr. Omar. So we have a question. I think you answered it already. The chances of conceiving naturally with fibroid. I think that has been answered.
Yeah. Early age pregnancy, as you know, if you look on the African, when they not live in the very abroad, or they have their children very early, and they have a fibroid also, but they are small because it's not grown that much to interfere with their fertility. Yeah.
Thank you so much. Yeah, thank you,
Welcome.
Dr. Omar.
You're welcome.
So before I move on to Dr. Barbara, it seems you have something to add, but before I come back to you, Dr. Omar, you mentioned something about yam. I love yam.
I know,
I'm so
all of
sorry.
you love yam. All of you yam. But yam have a lot of progesterone, you know that. Yeah. Mm-hmm.
Yeah.
Even that
So,
is why menopausal symptom is not that severe in the black woman, because you eat yam quite a lot. Mm.
okay. Thank you. Thank you very much. So Dr. Barbara, you wanted to add something?
No. I was just agreeing, because
All right.
it's true. Dr. Omar saying we don't start our family here same way they do back in Africa. So that makes sense why you see a lot of people struggling, because by that time the fight has grown quite a lot. Yeah. So that was.
I feel
Thank
so
you very
sorry when
much.
I'm in the clinic and I see 35, 38-year-old having multiple uterine fibroid. And when I talk about pregnancy and I say, do you have a partner? No partner. And that is really sad.
It's not their fault.
Yeah, no, of course. You can't have children with anyone. You just have for the sake of having children.
Yeah.
But it is quite difficult, especially now. You can't trust every man.
You can't.
All right, thank you so much. So before, because of our time, we're just going to take a few questions from the comment section. So, the first question is: would you advise to have surgery removed, fibroid surgery removed after you've had your children, or would you just live with it?
It depends. It depends how many fibroid they have and what they are suffering from. And sometimes I have seen fibroid the size of grapefruit, and I have size of the melon or watermelon. So this is not very good because of the pressure on the bowel, on the bladder, on the blood vessels. Just recently I heard in one of the hospital, the woman went with a bowel obstruction and necrosis of the bowel because the fibroid was the size of the baby. Even when they did a hysterectomy, they tried to do it, but the bowel was dead. So that is, it depends on the size of the fibroid. Yes, if you have a multiple fibroid, very big, and you finish your family, it's better to be taken away because it is growing. And also the pain and the pressure on everywhere can cause clotting. I have seen women coming to my clinic with a stick because of the pressure on the nerve. As soon as the fibroid out, they walked next day with their own, no sticks. Clotting. Sometimes the women come with clotting of the vein inside their legs, and you do a scan and you see there is a fibroid in their pelvis who is pressurizing all the blood vessel to come back, the blood to come back through the blood vessel. So it's not just about the fertility. When the women finish the if they are lucky enough to have their children, and it's better to be taken away. Although the problem, if you do take it away in early age, it will recur again. because not recur in the same place, recur in the other place because they are prone to.
Yeah, thank you
Yeah,
so much. Yeah.
thank
Thank you
you.
so much, Dr. Omar. So I see we have a lot more questions, but I'm just going to go on to Dr. Barbara and then we come back to the questions. So we can keep on dropping our questions. We have about 20 minutes left. So Dr. Barbara, I have this question. It's a bit personal at the same
That's
time.
fine.
So yeah.
I'm a
So
online.
what advice would you give to a woman who just got diagnosed and she's, feeling lost? I know you talk about this a lot on your page, but now you are coming out to talk about it in our community. So it's also going to be a two-in-one question. So the second part of the question would be, who did you turn to for support when things became overwhelming?
So the first part of the question, I think when you first get diagnosed, really important questions that I wish I knew back then, but understanding the type of fibroid you have. A lot of people know they have fibroids, but when you ask them what type, they don't really know what
Mm,
type of you have. If you're able to know, how many you have, because obviously the type you have is based on the location of the fibroid. And when you're diagnosed, you don't know to ask these questions. Is this the type of fibroid, like the submucosal? These are the ones I've had and I, battled with, fertility issues with. But when I was first diagnosed, no one actually said to me, listen, this is the type of fibroid that can really cause fertility issues and recurrent miscarriages. If I had
mm,
known when I was going, I would have probably pushed to have surgery earlier, I would say. So know if your fibroid can cause fertility issues, if you wish to have children in the future. So I think those questions are important. In terms of, and also, what changes do I have to make? Because no one talked to me about lifestyle changes I should now make. I did the research myself and, how to, cut down on alcohol, processed foods, red meat, all of these things. I actually went on to anti-inflammatory diet instead. But I had to do this on my own. That information wasn't given to me. So sometimes you do need to know more and kind of educate yourself, unfortunately. In terms of who I went to for support, I guess before I got married, it was very much like my family, very supportive. Like I really have a core memory of being in my bed one day, I couldn't get up because I was bleeding so heavy. And at that time, I had been bleeding. I think the longest I'd bled was like 23 days. I literally couldn't leave bed. And my dad, he was like so upset. We went to the pharmacy, got me stuff, bought me, have to wear the incontinence nappies because I really couldn't. Pads, tampons, that wasn't doing anything. And used to like a little care pack and just put it on beside my bed. And so yeah, I haven't had a really caring family. And then luckily when I got married, I got married to someone who was understanding, because when you get married you do not realize that you may have to struggle to conceive. That's not something you think about on your wedding day. You just think, we're married now, we bought a house, like left this baby. No one told me that I'd be trying for a child 3-4 years down the line. So having a support and a kind partner is so important. And I think that's just God. That was God that helped me with that, picking the right person who didn't always say to me, you're always bleeding. Because that's what some people say. You always got problems. You're always this. You're always tired. Men can sometimes be very, lack understanding and empathy. But he was very supportive and still is, and so I think that's something I would say to anyone living with fibroids. Be very careful the people you choose to be around you, especially in terms of a life partner, because this is something that you are living with, unfortunately.
Thank you so much for sharing your experience once again, Dr. Barbara. And thank you for, emphasizing on the importance of having, a very, very good support system around you. Thank you. So yes, back to Dr. Omar. We have a question on the comments and it says, please, how safe can we say RECO is for someone who is 40 years and plans to have children, or is surgery the best option?
It's a 40-year-old. How many fibroid is there? That's important. As I said, the one of the fibroid which is affecting mostly fertility is the one which is inside the room of the womb, has to be removed. That is, has to be removed, which is a minimal invasive. It's just through the camera, you put it in. You don't need a cut inside the tummy or anything like that. But the other thing which I like, the MRI scan should be done for every single woman with have a fibroid, because you with the ultrasound can see one and not see the other. So if the women have a fibroid, have MRI scan, they call FIGO classification. It has 7 types. So each type should be located and each type should be estimated. And then you make the sitting with the women, 40-year-old, it's not dangerous. It is basically, is it happening? Is the pregnancy is going to happen? If it is just small fibroid sitting on the top of the womb, of course it's not a problem. But every fibroid also during pregnancy is increasing in size and affect the pregnancy, can affect the miscarriage, can affect preterm labor, can affect pain, and the patient, the woman can be in the hospital in and out because of that, can affect preterm, as I said, and also the baby may lie down in the womb in a wrong direction, cesarean section, hemorrhage after the delivery. And also as a pregnancy increase the size of the fibroid because of the hormone. If I would, sometime I tell the patient, if you don't have the surgery, forget about it. Even the IVF will not work. So these are the you have to weigh which one needs surgery, which one doesn't need surgery. And you calculate, it's like a calculation. You have this, you have ultrasound, you have MRI scan, you have the age of the patient. You have one which is called AMH, which is counting the eggs, how they are viable and how they are good for that woman to start a family. She's 40. I have seen 40-year-old sometimes better than 25. It's just, everyone is different. So you have to have all these in front of you and then advise whether to have a surgery. It make the womb is better and make the life of that woman is better and become pregnant, or no, go for IVF if it's not happening by itself, or try for pregnancy and then later on to have a fibroid removed. Because as I said, is unfortunately nothing of them is without risking the fertility also. So you have to weigh, is each woman is different. But they can be pregnant. I have seen them. They can be pregnant. They come to labor and everything, and the fibroid just sitting between the top of the womb and inside the little bit, which is type, we call it type 6, and doesn't affect the pregnancy at all, and doesn't affect the fertility.
Thank you so much, Dr. Omar. Thank you. Yeah, so she actually responded that it's multiple fibroid. I think you addressed that. Thank you. So,
if it's multiple fibroid, it is mean and trying for a longer time, that's better to be taken away.
Thank you so much. You will all agree with me that it's been a really enlightening section today. It's been educative and at the same time fun. Thank you so much once again, Dr. Omar and Dr. Barbara. So, yeah, we have a few more minutes, but I just have, 1 or 2 more questions for you. So, we have various categories of women following us right now. Some currently facing fibroid issues. Some have maybe their sisters, their colleagues, their friends, and they're just looking for a very, very good support system and, educational information that they can use throughout this phase in their life. So for you, Dr. Barbara, what is one message that you will give to any woman trying to, figure out their step, especially in this phase and in this journey?
Educate yourself. I don't think you rely on, professional, and this is me speaking as a medical professional. You can rely on to tell you everything about what is going on in your body. So like you do with everything else, before you take insurance out, you will research about what's the best one, what's best for you. The same way same approach you should have for your health. You need to do the research. You need to know, because you're the only one that's going to live with it and experience it. So being will help you advocate for yourself more than anything. That is the message I would leave.
Thank you so much, Dr. Barbara. Educate yourself. Very, very important. I keep learning and I'm wowed each time. Thank you. So, for you, Dr. Omar, what
Mhm.
is, one thing that you would tell to any woman currently navigating their options?
I think the best thing first, the woman to like put a pressure on a
Mm,
healthcare to have a diagnosis, because most of the people, they don't have a diagnosis. They don't
mm,
know. I have seen yesterday a woman, she came back because she has endometriosis and fibroid, which I did a laparoscopy 3 weeks ago. And I felt so sorry. 35-year-old. She said for the last 15 years, she's going around and nobody listened to her. And this
mm,
is really difficult. So the most important thing, put pressure on the healthcare professional to diagnose you first. And when you have a diagnosis, you can, as Barbara said, is educate yourself what is the best for you. And don't just listen once or twice. Listen and go and say, what is my option? Because
mm,
some doctors just say, oh, go for have a uterus out. Some say, oh, you have the fibroid out. And the others say, oh, go take the tablet and go home. You have to educate yourself, but not too much chat GPT, please, because this gives you a lot of bad information. So
Very
you
true.
have everything is individualized, but
mm,
in my experience, if people shout, if people have a voice, they will listen to. And also one thing you have to know, I think some people they are not aware. A lot of private hospitals now they do public event. Public event it means the women around that area can apply and come and have a gathering and each one say about their symptom, and there will be presentation by the gynecologist, by the nurses for about endometriosis and about fibroid, about any other health issue. But watch out for those things because it has also come out on the internet if you want to be involved. As I have next week I have in Sloan Hospital in Circle Healthcare in Kent on a Tuesday evening is about endometriosis. So a lot of private hospitals, they do this also. They call public event.
Thank you
It's
so
not only
much.
for it's not only for the professional people. It's because professional, they should be able to know what is going on. But the public, they need to be educated more.
Yeah, I
Yeah.
totally agree. Thank you so
Yeah.
much, Dr.
Thank
Omar.
you.
So,
Thank
yeah,
you.
so this is for all of our audience and those that are present. We're just going to have a quick myth versus facts, rapid game. So, whenever I say anything, if you think it's a fact, you just write facts in the comment section. And if you think it's a myth, just write myth there. So, my first thing is fibroid always cause infertility. If it's a myth or a fact, please just write it in the comment section.
Mhm.
I would love to see what we have.
Mhm.
Okay. And also, if you think only older women get fibroid, just write it in the comment section if it's a myth or a fact. Okay. I'm saying myth. I'm saying myth. Thank you. And I'm saying myth. Yeah. Thank you. Thank you. Thank you, everyone. Yeah. Thank you. So I'm really glad that we've been able to, learn so much from tonight. It's been an insightful section. And I feel like it shouldn't end really. But it's so sad that it's so sad that we need to end the IG live soon. So for me, a key takeaway is that you are not alone. Your pain is real and you deserve to be heard. You need to weigh your
Yeah.
options, just like our doctor and Dr. Barbara said, put pressure if possible.
Mhm.
Research, just know yourself for yourself. Nobody knows you better than you. And like Dr. Omar said, please leave ChatGPT. Yeah, so thank you so much. And do you have a final word before we call it a night today, Dr. Omar? Any
The
final
final word.
word? Yeah.
Just look after yourself, be yourself, and you will be looked after. You'll be looked after. Don't be sad about it. Don't be saying that I am my age, I can't have any more children because of my age or something like that. Everything can happen, and there is a possibility even the women who have no partner can have egg freezing, and in the future if they find a right person, then they can have children. So there is a lot of opportunity around them.
Thank
And
you.
I heard in the radio and the TV also that day, they doing from skin cell a DNA which make egg and sperm. So that's coming also, but they're doing it with a squirrel now. They're doing it with a squirrel now, but it will, with a human being also come. So even if there's no eggs there, there's still future. So don't be sad.
Oh, thank you so much. Yeah, thank you
You're
so much,
welcome.
Dr. Omar.
You're
So,
welcome.
yeah,
Thank you.
Have
Dr.
a
Barbara.
lovely day.
Thank you.
Thank you.
Yeah, Dr.
Bye.
Barbara, we also want to have your final words before you
Oh my
go.
God.
Yes.
I think I would just echo what Dr. Oman said, because push. Push.
Yeah.
I just sometimes you have to cry.
Mm.
Even listen to, you know,
Yeah.
whatever you need to do to,
Mm.
you know, get someone to take you seriously, you
Yeah.
know, push for that extra investigation, because this is your health. You know,
Yeah.
you really don't need to have any kind of regret when it comes to it. Do all you can to get people to listen to you. That was what I've taken from it, and it definitely is true. Sometimes the loudest.
Yeah. Thank you so much once again,
Okay.
Dr.
Thank
Barbara.
you so much.
Really,
Thank
so nice
you.
having you. Thank
Good
you, Dr.
night. Good
Omar.
night.
Yeah.
Good night.
Bye, everyone. So you
Bye.
can do
Bye.
well
Bye.
to follow or save your notes. And let's all have a wonderful night rest. Bye. Bye, everyone. Bye.